Hi everyone, and welcome to the first Leading Health Systems Network webinar of 2020. For those of you who don't know, LHSN is a collaborative network of healthcare leaders and organizations dedicated to improving healthcare delivery, situated within the Institute of Global Health Innovation at Imperial College London. I'm very pleased today that we're hosting Rachel Dunscombe, who will be presenting this session entitled Systematic Design and Enterprise Architecture in Healthcare. Preventative Thinking is Needed for Cyber Risk. So Rachel is the CEO of the UK's NHS Digital Academy and also a visiting professor at Imperial College London. The format of today's session will be a 30-minute presentation followed by 15 minutes of questions. And can I just ask that you ensure your cameras are turned off and your microphone is muted. If you have questions as we go along, can you please type these questions to me, Nikki O'Brien, via the messaging feature on Zoom, and I will be sharing them with Rachel ahead of the question and answer session. So with all that said, I'm very pleased to hand over to Rachel to begin the webinar.
Thank you so much, Nikki. Appreciate it. I'm really glad to be joining you today to actually talk about systemic design and enterprise architecture in healthcare, and in particular how that plays into cyber risk. So actually a lovely picture here of one of my anaesthetists from Salford, who was involved in a lot of our work following the Wannacry outbreak. And I've got a lot of reflections to actually share with you, really, from the learning, both within the organisations that I was managing at that time, but also from other organisations that I worked with, and also some of the wider systemic design principles that we need to build into the future to make sure that we're not susceptible. So what am I going to discuss today? First of all, those lessons learned from Wannacry, which I think are very valuable for us as a system. Actually, Wannacry taught us a huge amount about what we were and weren't ready for, and also taught us a lot about things that we didn't really consider as part of our infrastructure and how important they are, things like medical devices, and also the sort of things we plug in for the citizens, Internet of Things, if you like. Then I'm going to talk about systemic design, enterprise architecture, and cyber as well. That is also very, I would say, pertinent for today's sort of environment where we're talking about adapting to change quickly. So very much cyber is about reacting quickly, having agile governance, being able to manage situations. And I think with COVID-19, as we're working through at the moment, many of those principles also ring true for what we have to do in terms of changing very quickly to have a system response to that threat, be it a physical virus rather than, say, a cyber virus. Designing for the future, I think what I would like to summarize there is how we marry together the design principles that we need for the future from other aspects, such as open data and so on, with the need for cybersecurity and how we can have a holistic thinking about the future. Then there's my conclusions. So really, where my thinking has moved along in the last 4 or 5 years in terms of my experience and what it has taught me. And then finally, get to some questions where we can actually debate some of these points and also open up some of the experience of the people on the call. Okay, so my first lesson around Wannacry is about designing to limit impact. Now, during Wannacry, many of us had to shut down parts of our network or much of our network, and many of us didn't really know what that were. And it was interesting. I did a lessons learnt for one organisation or set of organisations in a different part of the country. And what they didn't really understand is how they had segmented their network, how they had created logical or physical barriers between different parts of the network and different parts of the equipment, how they had segmented or not segmented different types of devices, be it medical devices, be it computers, be it, Internet of Things devices. Now, what we did learn from this is that segmentation So putting different things in different places so one little part of your network can be shut off is really important. And you have to put like-minded devices or similar things together. So an example of that may be certain legacy devices where you can't update drivers. They should all be in a separate sort of domain where they can't affect other devices. We had some scanners, for instance, in some of the organizations that I worked with, where the company was no longer trading, but it used old software and old drivers. They indeed should be segmented off as well. Then there's very good practice around how you actually design that segmentation and your network and how you understand it systemically. So the idea of DMZs or demilitarized zones for different types of equipment that have commonality and sort of similar risk profiles is really, really important. And that means that when you do get a major risk on your network, you can actually shut down parts of the network that are not absolutely mission critical while keeping other DMZs that have got mission critical sort of equipment running. So that systemic piece is really important, and designing that into any future networks has become good practice now, actually. And I would say at Salford and Penn, where I've been CIO, the future network design was very much influenced by this learning. So well thought out design using risk-based design principles are what we need to take forward in the future to make sure we limit the impact of any incident, or indeed the controls, so the shutting down of parts of a network to manage an incident, and being able to be very conscious of designing in that control for the future. So that was my first lesson. And it is lovely to actually see that the NHS has learned from that and is now procuring and designing networks differently. Lesson 2 is about scenarios and scenario planning. So one thing we realized when Wannacry happened was that we hadn't really run through any of these scenarios. And I remember talking with my organizations and also some other organizations about the way that you actually have preloaded rules within your infrastructure for the worst happening. So an example of that may be a firewall, which would actually take all the traffic out that wasn't essential. So it would knock off web browsing, it would knock off all of the things you didn't need to do and just keep the absolute essential clinical services running. So where we have those essential services and where you know what a threat could look like, you could create a number of scenarios and a number of rule bases that could be loaded into your infrastructure based on understanding what threats are there. And some organizations had a level of preparedness around this. So they were able to flip off non-essential traffic from their network very quickly so that they could actually limit the risk of anything spreading. So those pre-planned scenarios save both time and reduce risk when something does present. And it also stops inappropriate overreaction to that threat. So another thing that I saw in preparing lessons learned with organizations was a vast overreaction which actually shut too much down and had impact on clinical services. So pre-thinking what your minimum clinical operating infrastructure is in terms of network and ports and kit will allow you to put what I would call a skeleton rule base in. And if you can load that, if there is a threat present, then you know what you're doing is reducing risk while keeping the essential services open. So that was my second lesson learned. My third lesson learned was about designing appropriate governance. Now, much of what we saw in the press was, you know, sort of hospitals being brought to their knees or, you know, sort of patients not being able to be seen. And it was really interesting for me to look at how humans and governance reacted to the process. So actually, you know, not talking about technology, but how did humans react and how did they make decisions and what was the infrastructure they used to make those decisions? Now, one of the organizations, again, that I went into and did a lessons learned had a very, very prescriptive change process. And that change process listed the people that were allowed to make changes. And they weren't able to make any changes without a full change advisory board meeting. And they had to wait. And in that time, the virus or Wannacry, malware spread across their computer systems, and they had a significant number of devices with it on. In the lessons learned, we looked at that and they said, well, we had to follow our change process. We had to get senior sign off. And actually what they had was a one-size-fits-all governance, which potentially is not actually fit for purpose for emergency changes or for an emergency sort of situation. What's interesting there is how empowered people actually feel to make a decision that the governance in front of them is not fit for purpose in an extraordinary situation. They either need to feel that they can flex that governance and have the ability to do so, or have something outlined to them about how they deal with extraordinary circumstances. Another organization had that extraordinary sort of planning in place, and they basically said, if you can justify why the governance is not fit for purpose, then document what you're going to do, why you're going to do it, and take a decision. They very rapidly decided that at a sort of medium management level, they were going to do things and inform people of what they'd done and why in sort of retrospect, so it didn't hold up decision making. They prevented any spread. There was just one device that actually was infected there, but because of their empowerment, rapid decision making, and also a pre-degree of talking about all sorts of scenarios that may need rapid decision making, they actually felt empowered to move forward in an appropriate way. Another one was some really good practice that we saw about an organization who had done some real planning about this and said, well, what if something bad happens in the cyber world or in the infrastructure world? And they had pre-arranged what they would do with various third-party suppliers, including cybersecurity companies, and had a pre-agreed protocol to actually call on them. That organization pulled in experts from industry at very short notice to support them with challenge decision making, and also with ensuring that they were absolutely up to date on all of the knowledge around Wannacry as well. That's something that had taken a degree of pre-planning, and in itself was designing what I would call appropriate governance and appropriate responses to the extraordinary situation. So, enterprise architecture and systemic design. What I've just talked about there is about designing technically and designing governance into your systems and allowing both of those to be flexible. And I'm going to come back to why systemic design is important for the wider health and care system. So let's forget cybersecurity just for a minute and talk about why we need to design for the future. So first of all, as we approach AI in a world where we're using analytics and risk stratifying individuals, precision medicine, and so on, we need clean, codified, real-time data so that we can make decisions. So that's one thing that needs a very systemic design sort of approach to make sure that we are designing a set of data that can pervade for an individual's life and beyond, indeed, so that we can use that for decision making in the health and care and the wider system. As I said, data is for life, not just for patients, but the whole of the health and care system. And so we need to systemically design for data to be coherent between our different systems. We have more and more systems coming on board, Internet of Things. We have, data coming from the patients. We have data for integrated care systems, and they're all adding to the complexity that we could have unless we made this a very systemic design for data. And so it's more important that we ensure that all of our data can cohese together and be used in harmony. We also have those systems that we sort of don't have control over. So there are certain black boxes in our infrastructure. Some medical devices are black boxes, some of our legacy systems are black boxes. And again, we need to design towards the future of not having black boxes with their own bespoke data in them. Medical devices are growing ever more. And, you know, I can still think of the infrastructure that I had at Salford and Pennine and Bolton with, you know, very old devices that had serial ports, you know, that used to, you know, not have non-resilient text files. We need to move that into a systemic state where we have resilience over the data. And public and their data is now a major consideration as well. So the data they contribute, the data that they want to join with, the data in the health and care system. So for all of these reasons, we need to make sure that we design systemically. And that design also extends out to cybersecurity as well. So for me, the future architecture needs a number of design principles. And these principles both serve those sort of emerging issues that we looked at on the previous slide, but they also, you know, serve us well for cyber. So we must simplify and standardize our systems. The more complexity we have, the more we will not be able to respond and control and secure that infrastructure. So I'll give you some examples. The average acute in the UK may have somewhere between 600 and 1,000 different systems, and that's growing as we add these new data sources in. Many of those hold data in bespoke formats. Many of those we don't understand the full data structures of because they're brought in from third parties and we don't understand the underlying sort of schema. We need to simplify and standardize those systems so that we can both understand the data that we've got that we need to join together for our citizens to create their records, but also so we know where our data is, how sensitive it is, and how we secure it. So coming back to what we said earlier, if you're going to build rule bases or risk stratification around your systems, you need to know what your systems are, what data they hold, and what risk profile they hold. And if we are going to allow a million flowers to bloom in terms of more data sets, more data types, more devices, our infrastructure will become less controllable rather than more controllable. And so there is a very good case for standardization of data and reduction in complexity of the data types we hold and the schemas we use in terms of cybersecurity, because we need it to be manageable in terms of understanding what we own. We also need to understand what we own in order to orchestrate change. At the moment, as I said, there are hundreds of systems in the average acute, maybe over 1,000. What we have now is, it is basically very hard to catalogue, understand, visualize, and we need to be able to get that into a more controlled environment. We have to be able to design for the future and orchestrate change forward, knowing what our baseline is. And that has to be something where we understand the risk profile of everything we do. So for the future, that sort of orchestration forward and the rapid evolution of models of care towards integrated care and so on will need us to make sure that we have a full handle on all of our systems, the data that they hold, and also how we should manage them in terms of cybersecurity risk. So the technology is increasingly moving to support care in a more sort of critical way, I would say. So, you know, we used to use technology to probably annotate the activity we did. The history of say, you know, hospital systems were patient administration systems where we counted our activity. We've now moved to a world where we're using this technology to literally power what we do. So, you know, we're using it within our drugs drivers, our ICU machines. We're using it within, you know, theatres to actually enable us to undertake complex operations. These things are now, in many cases, life critical and increasingly life critical. Our risk strategy needs to acknowledge this. We're not in the days of just a PAS and a few administration systems. We are now in the world of the clinical. And as we become more and more mission critical, where our technology is basically as critical as our buildings, we need to make sure that we actually adapt our risk strategy to acknowledge this. And so cybersecurity, to a degree, needs a framework where people can actually make risk judgments about the approach that they are taking for different systems. So coming back to what we talked about earlier, there are certain absolutely life-critical systems. I'll give you an example. So some of the systems that we have in theatre, like scopes and radiology, actually have to be present on working for somebody on the table to be operated on and for an operation to continue. You would say that they're very high critical systems, and those would be prioritized in terms of availability and resources in the instance of a cybersecurity incident. As I said earlier, web browsing, say, and perhaps some of the systems that you have around, I don't know, finance and so on would not necessarily get that prioritization in the case of an incident, but that needs to be pre-thought out, and all of these systems need to be risk stratified in terms of their availability and their response in the case of an incident. We need the NHS and healthcare systems globally to become the intelligent client for technology. So what we see here is that much of the lessons learned around Wannacry were around there not being the capacity and capability to understand the infrastructure as it was today in the systems, and actually be able to react and design processes to enable those systems to remain highly available where they needed to be. We need to design this into our purchasing decisions for the future. So both in terms of our specifications, but also our buying behavior. So where we do buy mission critical systems, we need to know that, the vendor, our partners that we buy from, have cybersecurity built into those systems, that it's part of the consideration that they have the appropriate, say, ISO standards and cybersecurity standards. We need to understand how those systems work in terms of the data they hold and how that data is exposed. We also need to know any third-party libraries and so on that they may depend on, which may have vulnerabilities in them. And we need to be very cognizant of that in terms of the business's appetite for risk. And what I mean there is, which systems are absolutely mission critical? Do you within your organization have the list of the 12 or the 18 systems which must remain available? And we must purchase those systems to be high availability and very resistant to cybersecurity risks, and we need to design them into our architecture in that sense to make sure that they are protected. So my conclusions, I think for me, the last year and a bit, 2 years, has been a time of taking stock, both from what I learned from Wannacry, but also some of the other things that emerged for us around cybersecurity and around the mission critical factors for the absolute dependence now on technology for those organizations who have really digitized. The first one is to standardize, simplify, and document. As I said earlier, we have very complex systems and we have a risk of making it even more complex. We will not be able to control or manage our systems unless we simplify and standardize and document. We all understand what we're controlling. And part of that is moving to open standards, open data, standards around cybersecurity, standards around cloud hosting, to make sure that there are not too many variables in the infrastructure that are unknown. We need to own and understand all our systems and data assets, including devices. Another piece of Wannacry was based on the fact that we didn't understand that medical devices, in many cases, were powered by computers or by software. So there may be a Linux device actually embedded in a piece of hardware. And doing a wash up on that, again, with some of my peers, we found that really we now need to categorize many medical devices as computers or cybersecurity valid devices, i.e. things that we need to operate in the cybersecurity domain. We need to update and manage our risks dynamically with Agile governance. So the idea that one size of governance, like a cybersecurity group once a month or a risk group once a month, is not really an appropriate response to everything that happens within cybersecurity. You do need to be able to look at cybersecurity strategically, but you also need to put in processes that allow agile change and reaction to real-time threats, and allow you to deal with cybersecurity threats in the moment as well. And so that sort of cadence of governance, which we work with now, sometimes forces us to do everything on, say, a monthly basis. What we need is the ability to do extraordinary things with justification. And indeed, when there is a major threat like Wannacry, be able to react very much in the moment rather than in 12-hour sort of delays. So that's really important. We need to look at how we govern a more dynamic risk governance and agile governance frameworks. We need to create enough headspace for our staff to master the details of architecture and infrastructure. Very much our frenetic sort of working day in technology means that not everyone necessarily has a shared frame of reference about what our architecture is and what our how our infrastructure works. And a basic for that really is to document that and keep a living map of everything you've got so that people can explore that and work on it together. But it's surprising how many places don't have one unified articulation of everything within the enterprise, and they don't have one place people can go to look at that together and to explore perhaps cause and effect of different systems on one another. Both for that design for the future and also for real-time assessment impacts, it's important that people all share that frame of reference and that understanding of what, say, a hospital or a CCG or a healthcare organization globally has within its its infrastructure, and that includes both people from the business as well as people from the governance teams and the infrastructure teams, because you also need information asset owners, so people that understand how the information is used clinically and can help you make risk assessments about the criticality of those systems. But that all takes a bit of time, and that takes time to stand back and be able to maintain that state of the nation, if you like. And not all organizations create the headspace to do that, but the lesson learned is that those that do have a much better response in terms of both cybersecurity when an incident does happen, but also design forward into the future world. As I said, the document and a shared map of technology and assets, information assets, is really important. It's interesting to actually talk to people about the concept of sharing frames of reference when you actually go into a sort of emergency situation, and that's something that is conceded in other areas of emergency planning. But the more you share a language and a frame of reference that you can use during an incident, the better you will respond to it. But if people use different language and mean different things, then you have a friction in communicating and agreeing a way forward. And so it's very important that we understand and share that frame of reference. One thing that not many organizations had done before Wannacry, and still many have not done, is simulate cyber threats and feed the learnings into future design iterations. I've personally been involved in major incident training, but they have been around train crashes or plane crashes. They're all very physical scenarios around people and transport and road networks and so on. What we haven't really done traditionally is think more about the cyber world. And as our infrastructure digitally becomes as essential to us as our buildings, I would say, it's important that we simulate those threats. And as we simulate those threats and allow our teams to go through that learning, they then form an understanding of how they would work in the real scenario. And so I think it's very important that that becomes part of our continuity planning, and it becomes part of our exercises, either as a whole scenario for digital or a part scenario in terms of how we deal with partial loss of assets and so on. We need to work with boards and senior managers to agree their response to threats and build a common understanding. So many boards didn't really understand how to deal with the concept of the cybersecurity threat and Wannacry. And it's quite interesting for boards to, again, build an understanding of how they deal with cybersecurity. So actually understanding how they can make sort of models that they share around cybersecurity risk, and also look at how they deal with other risk types like clinical risk and so on, and then make analogies along to how, alongside that of how they would apply those skills that they have of managing other risk types to cybersecurity. That typically does take some space in the boardroom and in senior sort of exec meetings, but taking that time to pre-plan really allows them to be more confident with the response and feel that they understand what they're dealing with. I think a number of people are on call or major incident managers for organizations when Wannacry happened didn't really begin to understand what was and wasn't happening within their organization and the potential other than talking to those people that were around them at the time. And again, sort of board sessions with specialists who can allow people to understand how to manage risk and how to frame the different sort of scenarios that could happen and allow people to feel that they have an ability to manage the risk appetite of the organization is really important. Working with national agencies, peers and specialists is an emerging piece where we are now seeing, different sectors collaborating together with healthcare and the NHS in particular on best practice and learning. And that is one of the best things that has come out of Wannacry, is that much wider ecosystem of cybersecurity that has emerged. But that needs to be a place where our organizations concede that, they need people to go out to security conferences, to work with their peers, and to understand other approaches that industries are taking, say, to cybersecurity. And this is one place where, certainly aviation, military and others have got some very good parallels for us in terms of keeping very high availability and high risk infrastructure safe. And finally, building cybersecurity considerations into every project and procurement. So again, as you design your future state, don't just think about how you need your data to be open and interoperable, but also consider the cyber profile of the sort of elements that you're building in. And indeed, organisations in the NHS and other healthcare organisations across Europe, I know, have been working towards Cyber Essentials and Cyber Essentials Plus, but that puts some great discipline in around everyday good governance, I would say, for cybersecurity. So finally, I would like to take the questions that you've got for me. I know there's a couple of questions, and I would like to know, Nikki, is now a good time for me to start answering some of the questions?
Yes, please go ahead. And if anyone has any questions they would prefer to write to me anonymously, please also do so while Rachel is speaking.
Good. Okay, so the first question I've got is around the best way to communicate through the system and to different types of stakeholders you are working with. And I think there are two forms of communication. So the first piece of communication is actually increasing the cyber savviness of your workforce. And the approach that I actually took at Salford was to work with Barclays using the Digital Eagles program. And the reason that we did that was we wanted to make our staff both safer in the workplace with cybersecurity, but also safer at home, so that they were less likely to be susceptible to phishing attacks, banking wise and so on. And so there is a piece of communication around creating a digitally ready and digitally savvy workforce where they understand more about the risks and feel more confident both in their personal life and their professional life. I think also anchoring language in there that becomes familiar, which they will understand later on if there is an incident, is really important, because explaining terms while people are perhaps undergoing their IG training so that they internalize those and have time to understand them is far better than starting to use them in an emergency scenario. So taking time to proactively communicate good practice and putting that in with your information governance training, say, is really important. When you actually come to an incident, and where something may be happening that is extraordinary, using that language and using the organization's communication channels is really important. Now with Wannacry, we saw that we lost an awful lot of our capability to communicate because people were shutting down parts of their networks, they were shutting down email, all sorts of things. And so having parallel channels to allow communication is really important. Now those parallel channels may include pop-ups on desktops, it may include sort of mobile device push notifications or whatever, but making sure that you're making people comfortable with what is happening, keeping them up to date, and using that language that they are familiar with is very important. I would say that a number of great practices and very dynamic communication routes were thought about during Wannacry. So a number of organizations set up WhatsApp groups to keep people up to date, both at a senior level and on the ground and in services. People had shut off email but started using desktop pop-ups, which could be controlled within the infrastructure. And so really planning for those scenarios of how you will communicate, say if email is lost, or if you actually lose, say desktops, how you would communicate with your staff if you have their mobile numbers is well worth doing as part of your contingency planning. Okay, I've got another question that's come through here. This is around organizations with limited budget and systemic design. So what areas should they focus on, and how can you maximize your impact for little cost? And that's a really, really good question. So I think most networks allow people to segment different sort of risk profile devices into different DMZs, as they call them, demilitarized zones. And what you can do with very little cost is just start making sure that your network is actually risk stratified in terms of those profiles. So legacy, say devices, medical devices that can't be updated, say, would be put into certain zones. Then your EMR might be in another zone, and your imaging equipment might be in yet another zone. But actually working out how you can use the capability of your network and your firewalls now to actually segment things that could cause each other a problem in a scenario is something that is possible now, but hadn't been fully thought through by many organizations. And in a lot of cases, I think that doesn't cost that much more in terms of licensing or indeed hardware. It's just a matter of getting that right logical design together. So with little or no cost, focus on that design, and also the systemic design in terms of the governance that you have for designing forward. So if you have a set of design principles for the future, if you can list 5 things on a page that you should always consider before you put something into operation, in terms of the cybersecurity risk profile it has, how you should deal with it if there is a cyber incident and so on, then that is probably the best way to deal with what's in your gift now without a huge amount of money. So from my perspective, after Wannacry, we didn't spend huge amounts of money, but we did do a lot of thinking and a lot of lessons learned, which changed how we operated. It wasn't about buying huge amounts of hardware or software. It was a bit about education as well. Okay, so another question here. So what are your views on starting to use cloud-based services in the enterprise? Does this increase the risk profile? This is very timely. I actually spent some time yesterday talking about this with some American organizations. It changes your risk profile is the answer. It changes the risk profile because there are different things within your infrastructure and there are different considerations. So for me, obviously you are then dealing with external bandwidth to, cloud provision, which is something that is different to many of the systems we have on site today. And you're also dealing with systems that are often, depending on what kind of cloud you buy, automatically updated by the cloud provider in terms of sort of drivers and operating system and all those good things, which means you're less at risk. But that in turn means that you've got to actually risk stratify the entire piece differently, because if you're putting critical and essential systems out into the cloud, you have to evaluate if the availability and the SLAs from those cloud providers are suitable for that high availability clinical system. If you're putting it out there, you have to risk stratify what are the risks of there being a cyber attack or other incident with my connectivity, and how resilient is that? And you also have to look at any other sort of considerations that there may be around cloud hosting and how it operates. So, you know, you've got software as a service, you've got platform as a service, you've got the different scales of cloud. Some of them are more under your control, some of them are less under your control. And what I would certainly say is that do not move to cloud without reorientating yourself in how you would risk manage each of those levels of cloud. So overall, I am more pro-cloud. I'm more pro-cloud because you know, many of those elements get updated for you. And actually, we can't get to really old hardware because you're paying a subscription basis. You can't get to the point where you've got susceptible hardware where you can't update drivers, say. But on the flip side of that, you can't always get the service levels you want. You may have, you know, concerns about denial of service on your links to that cloud. And so it really is a different mindset, which again, needs to be considered before you actually put it in there. And it's certainly before I put any clinical systems in the cloud, took a number of months of design and risk exploration before we did that. So I would say it's a new skill set. And as I said before, with that map of your infrastructure, you very much need to get all of your teams who are working around this to understand what the new world looks like so that you can actively manage the risk. So I think it looks like we've come to the end of the questions. Nikki, is there anything else from your side?
No, Rachel, thank you very much for a really fascinating presentation. I, for one, really enjoyed hearing about the sort of scope involved in this kind of architecture. So we will now close the session. But if anyone does have any further questions, you can see on the screen, Rachel has kindly provided her email address. So perhaps you might want to email her to get any clarity on anything that she's discussed today, or to ask anything that comes into your mind later. So yeah, we'll now close the session, but keep an eye on your emails and on social media for details of the next LHSN webinar, which will be held in May. And I thank you all again for your participation today. And I will now close the meeting. Thank you, everyone.